My name is Michael Muscato, and I'm a candidate for United States Congress in Arizona's CD8. As you may have heard, there's a good chance 20 million of you will lose your health insurance soon. You may have also heard the crickets from the Republicans in Congress who promised better and cheaper health care, but in 8 years have failed to come up with any plan to replace what we have now. Rather than complain like my opponent, I decided to take the bull by the horns and create a healthcare plan that allows you to keep your own doctor, provides coverage for people with pre-existing conditions, reduces the economic cost to employers, reduces the out-of-pocket costs to individuals and families, and the best part is, it's not a government takeover of healthcare. I call it AmeriCare, and it's a new approach to how we obtain and provide healthcare. AmeriCare's goal is to drive down healthcare costs, give Americans 100% medical coverage, and provide the financial resources needed to fund the program. I think you're going to love it. AmeriCare covers medical care at 100%, pre-existing conditions, veterans at no cost, Medicaid recipients, and all American citizens and anyone else paying the 1.45% federal payroll tax and monthly premium of $180. And lastly, it covers the costs of prescription drugs. AmeriCare costs $180 per month, no deductibles, and no copays. How's this possible? Let me show you. In 2018, our annual cost for total health care in the US was $3.6 trillion. That's more than $11,000 per person in the United States. Looking at those costs, several things jump out as areas where we can save massive amounts of money. Administrative costs make up 30% of our total healthcare costs. That's roughly $1.08 trillion annually. A lot of this cost is simply because there are so many private insurance companies, each with their own systems and processes. By using AmeriCare's single-payer system, we can conservatively save 15% off our entire healthcare expense. That's an estimated $540 billion annually. Americans pay nearly 3 times as much for prescription drugs as the rest of the world. Why? It's because of a lack of independent regulation. By adding a prescription drug board to determine the value add for prescription drug production and regulation on pricing to prevent extortion, we can reasonably expect to save 50% off our current prescription costs. That saves us $250 billion annually. Hospital expenses account for roughly 30% of our healthcare cost. Nearly 65% of our ER visits are used for non-emergency treatment. This is not the purpose of our hospitals, and this misuse is costing us billions. By providing access to healthcare for everyone at affordable prices, we estimate that hospital expenses can be cut by more than 50%. Conservatively, we estimate this would result in an additional $540 billion in total healthcare savings. In 2018, employers paid an average of more than $13,500, and employees paid an average of more than $6,000 for employer-provided healthcare premiums through private insurance for a family of 4. AmeriCare's single-payer 100% coverage model will reduce employer costs from a conservative average of $10,000 to $6,000 annually. That's a conservative estimated savings of $4,000 annually per employee. Okay, that's how we will cut the costs. But how will we pay for the cost of our healthcare? Here's how. Do you pay your taxes? I know I do. So how come these guys don't? You'd think, after getting 14% knocked off their tax rate, they'd actually pay. Well, they will now. We're going to collect that tax. That will give us an estimated $100 billion annually in tax revenue, which we can direct towards our healthcare. In year 1, by collecting the owed tax on the $2.5 trillion being hidden overseas, at a new 21% tax rate, we would see an additional $525 billion in revenue in year 1. The current Medicare federal payroll tax of 1.45% from employees and employers will roll right into AmeriCare. Annually, this brings in $289 billion. The current population of the United States is 328 million people. 155 million of those people would already be covered by their employers. 90 million Americans currently pay for their own private insurance, and millions more will now be able to afford medical insurance and become enrolled in AmeriCare. Medicare recipients would also roll directly into AmeriCare. No more Part A, Part B, Part C, just $180 a month. AmeriCare contributions will support coverage for 415 million people. This surplus will be used to offset Medicaid, cover veterans at no cost, and support the Child's Health Insurance Program. Everyone knows our healthcare system is broken. We can either continue to try and patch together the same failing healthcare system, or we can streamline the process and focus on providing healthcare to our citizens. AmeriCare could be the answer to our country's healthcare problems. It hits all the key points the majority of Americans say they want in an insurance policy. It isn't perfect, but it's a start. AmeriCare wasn't created by career politicians, lobbyists, drug companies, or even insurance companies. It was created by a small business owner who was concerned about other business owners and families. Who would you rather come up with the idea? One of them or one of us? We can keep electing the same representatives who are funded by big pharma, corporate lobbyists, and insurance companies, or we can elect leaders who provide solutions to our issues and are loyal to only the American people. My name is Michael Muscato, and I'm a candidate for United States Congress in Arizona's 8th Congressional District. I approve this message because our future, our country, and our hometown are always worth fighting for. Thank you for listening.